plug in the first place. From a cost standpoint, it does have a bearing on cost. And so we have to decide what it's worthwhile to invest in our country for that, for care. One of the things that is also not being talked very much about that I shared the other night that I struggle with on a daily basis, and that is dealing with medical malpractice litigation. Now, we in hospitals are not perfect. We make mistakes, and I'd be the first to admit that. But we deal day in and day out with folks that come into the hospital and say to us, unless you do this, unless you do this test, or I want all of these things done for my family member, unless you do all those things, I'm going to sue you. And they tell that to a physician, and while there are some physicians that will stand up to patients and say, you don't need that test, we're not going to do that test, many physicians are intimidated enough by folks saying, I want this or I'm going to sue, that they'll go ahead and write the order for that MRI scan or for that CT scan or something else. We need to deal with that from a cultural standpoint, I guess, within our country and within healthcare, to not put physicians and hospitals into situations where they feel intimidated or forced to spend money on things that, from a clinical standpoint, the physician would say, don't need to do it. I think we had a situation that occurred some months back. We had an individual, his father was on Medicare. The father was the patient. He was in the hospital. He had given power of attorney for health care and other decisions to his son. The son was unemployed. The only income to that home was the Social Security check that's coming in for that elderly man because the son was not employed. And the son is in our hospital saying, I want everything done for Dad. I don't want him to die because he's my meal ticket. Oh my God. That kind of, well, while again, we're not in the business of making decisions about whether or not he was right or wrong, it was obvious what he was saying. The only reason that he wanted Dad around is for the Social Security check. And he said, when Dad dies, on whoever's watch he dies, they're going to get sued because they let him die. That kind of thing is a real challenge for us in healthcare. And I don't know about the businesses that you all were in, but if you had that kind of intimidation or threat, many places, if somebody walked in to an automobile repair shop and said, if you don't get it right, I'm going to sue you, they probably turn around and say, why don't you take that on down the road? Well, in healthcare, that's not something that we do. One of the things that's been talked about, and it's not in the Senate version, it still is, I believe, in the House version, and that is what is called the public option. We in hospitals have a real concern about that public option from this standpoint. In Missouri, the average payment for Medicare patients, and Medicare is of course the federal program that we believe that the public option would be tailored after. The Medicare program, when we have a Medicare patient in the hospital, we typically, hospitals across the Missouri, lose 11% on that patient. We don't even break even on that patient. We have a margin of a minus 11% on Medicare. If we allow the public option, it's my belief that the federal government will say, we already have these contracts in place with hospitals, and so let's just use that Medicare reimbursement for the public plan. They can sell that plan to the public, and because they are at least 11% less expensive than what the private plans that are out there, eventually the private plans will be driven out of business by the public plan, and we move a lot closer to what has been described as a single payer system, which has some disadvantages in my estimation. Let me stop there. I've shared with you some of the things that I perceive are a concern. Again, in the Senate bill, I think the other night I said 2,000 plus pages. I've forgotten your name, you corrected me, the 2,400 and some odd.
Yeah.
Obviously, again, I haven't read all of those.